As we close out Breast Cancer Awareness Month here at 105.5 WDHA and our stations with Jersey Magazine, my guest this morning is the CEO of ImageCare and the Medical Group of New Jersey, Andreia Lima. Good morning and welcome.
Good morning. Thank you for having me on.
Now, you've been with ImageCare for 16 years. What's the biggest change that you've seen in terms of technology and maybe diagnosing breast cancer?
Definitely AI coming into the picture. AI has taken a huge lead and it's let radiology, become preventative healthcare. It's like having a second pair of eyes on all of our exams now, and especially with mammography, you're having a board certified radiologist read your scan as well as AI scrubbing it for anything we may miss.
You mentioned AI and you kind of anticipated the question I was going to ask you. How has it? Because a lot of people are very concerned about artificial intelligence. They hear it and they're a little taken aback by it. And yet it's being used so many different ways.
Yeah.
How has it affected how you use it in mammography?
It's just like I said, it scrubs the imaging and it pinpoints areas of concern for the radiologist to then review. It is not by any means reading on its own. So I understand the trepidation because it is new technology. But again, we're such an innovative company. We're used to it. We've been using it for years now, and it's just an additional tool that actually makes your reads a lot more accurate.
And I know that you also do 3D mammography. Tell us about
Correct.
that.
So 3D imaging is just different slicing of the imaging. It gives you, if you're looking at a loaf of bread, for example, and you can cut it up into slices, you're looking through all of the slices of the breast tissue. So it's a great tool to have. And we actually do our breast imaging with just 3D. We use Siemens 3D, Revelation and Inspiration units.
And how does, like, for a woman who comes in and she's maybe a little bit nervous about this, especially if you're coming in for the first or second time, how does this help maybe calm them down or just reassure them?
I think people want to have accurate diagnosis and they want to feel comfortable in the units. We have one of the most, like I said, comfortable imaging units, which is the Revelation and the Inspiration 3D units. And, as far as mammography goes, I think patients are a little wary. Is it going to be painful? Our units actually have compression stops. They know exactly when to stop at the breast tissue. We apply just enough pressure and it ends up being actually a comfortable exam for the patient experience.
We mentioned that you've been with ImageCare now for 16 years. What was it in
Yes.
your journey that brought you there?
Well, I actually grew from the ground up in the company. I'm very proud of my journey because I've worked in every facet of the company, from front desk to technologist to marketing to financials and now being the CEO. So I'm really integrated in the field and in the company. It's really about my love for strategy, patient workflows, patient experience, and I love being on the side of cutting edge technology, which radiology and image care is.
And what's a good age for a woman to first get a mammogram?
If you're at risk, the recommendation is to start at 35 years of age. And again, there's so many different risk factors from environmental to, genealogy or family history. And the patient may not necessarily know that they're at risk. So it's a good idea to speak with your primary and see if you qualify to start at 35. Otherwise, 40 years of age is still a good age to start. I actually started at 35.
And was that as a result of maybe family history?
I actually felt a lump, and I wanted to make sure, again, having access to the best technology right here in Hackettstown, I wanted to clear myself and make sure that everything was good, and thankfully it was.
And how often should a woman be tested?
Annually. Radiology and image care radiology really prides itself on preventative healthcare. So, check with your insurance and your primary based on specifics to you, but annually would be amazing.
And you mentioned preventative just now. What are some of the preventative measures that women can take?
They really should be, doing some self-checks and speaking with their doctor if there's anything of concern. Their age, if they're 35, they qualify for the preventative mammography. And if they have breast tissue identified in the study, cancers can hide in dense breast tissue, then we recommend ultrasounds to, again, take a different perspective at that breast tissue, and MRIs if need be. All of this can be considered preventative healthcare.
And with more than a dozen locations, it kind of goes back, Andrea, to that radio cliche. If you're within the sound of my voice, but with more than a dozen locations throughout New Jersey, if you are able to hear us, there's definitely one near you. For more information, you can go to imagecarecenters.com. Andrea, thank you so much for your time this morning here on Jersey Magazine.
Thank you for having me on. It's been a pleasure.